Welcome. My name is Crystal Chipman with Northern California Grantmakers. We're so excited to be partnering with Homebase and Tipping Point Community. This is a Bay Area Homeless Funders Network program. So if you want to know more about future programs, please sign up for our mailing list. My colleague Sarah will be putting that in the chat. Please introduce yourself as you come in, and also this webinar will be recorded. And without further ado, I will pass it over to Chris.
Great. Thank you very much, Crystal. It's good to be here with you all. I'm Chris Block. I'm the director of the Chronic Homelessness Initiative at Tipping Point. We have some construction in the background, so I'll apologize ahead of time for that. I want to thank everyone for being here and to share with you a 30 seconds on the work of CHI and Tipping Point, only to say that, we're a $100 million initiative and we've been investing in a significant number of initiatives. We're building 145 units of affordable housing, cheaper and faster. We have a significant flex pool, on and on, from the standpoint of programmatic interventions. And I would say that none of that is clearly more important than our transparency and accountability work. If we're not transparent and upfront about what we're doing, and if what we're doing is working, then we can't be accountable to one another. And if we can't be accountable to one another, then we can't effectively address a complex problem like homelessness. We have to know what's working and not working, and then have the courage to do a lot more of what's working and a whole lot less of what's not working. And so the bottom line for me is that when we have the kind of data sharing and accountability that comes as a result of it, that we're talking about here at Homebase and with this panel, then we take a huge step forward, another huge step forward in solving this complex problem. So I'm looking forward to listening to the panel. It's a great one, as you will know by the people in it. Their reputation precedes them. Again, I want to thank you all for being here. Thanks. And I then am Amanda, I'll hand it over. It says in my notes here, Amanda, I'll hand it over to you.
Thanks, Chris. And thank you so much to everyone who's able to join us for the webinar this morning. We're so excited to have you with us. My name is Amanda Wehrmann, and I'm a Deputy Director with Homebase. We're going to tell you a little bit more about our organization in just a moment, but first we wanted to give you a quick overview of our agenda for today. So we're going to give a brief presentation on our framework for regional data sharing, including the challenges and the opportunities. And then we're going to moderate a discussion with an incredible panel of speakers, as Chris said, to really unpack the benefits of regional data sharing. And we'll reserve some time at the end for Q&A. So please feel free to put questions in the chat, and we'll make sure to answer as many as we can. Before we start our presentation, though, we wanted to take a quick poll to get a sense of your level of familiarity with homeless data systems. Crystal should be putting a poll up on your screen. And if you could just quickly answer the poll, just how much do you work with homeless data regularly, or have you heard of HMIS, or maybe you're just new to the topic and you're here to learn. We're just trying to get a sense of everybody's understanding of homeless data. We'll just give folks another bit of time to answer the poll. Okay, and it looks like we have a pretty split group here. We've got about a quarter of you work with homeless data regularly, another 35% have heard of HMIS, and then 40 are here to learn. So that's really helpful. Thanks for taking the time to respond to the poll so we can get a sense of everybody's understanding. So with that, I'm going to hand things over to Nika Rapkin, our Executive Director for Homebase, to tell you more about our regional data sharing work.
Thank you so much, Amanda. And good morning, everyone. I'm Nika Rapkin, and I'm the Homebase Executive Director. Homebase is a public policy nonprofit. We're based in San Francisco, been in there for over 30 years, partnering closely with cities and counties in the Bay Area and nationally to respond to homelessness. We support rural, suburban, urban communities across the country. designing programs and systems and working with local leadership to create shared vision across stakeholders to end homelessness. In 2018, we were asked by local leaders in the Bay Area to convene a regional working group of the homeless system leadership across the Bay Area counties. We've been doing a variety of regional initiatives with our partners since then: system mapping and gaps analyses, action labs on racial equity and unsheltered homelessness, and then this work on the regional data sharing infrastructure in partnership with Tipping Point that we're very pleased to be sharing with you all today. After we started the regional working group, almost immediately, one of the key takeaways was that the inability to share data across county lines is a major barrier to being able to serve the homeless population in the Bay Area. Like all of us who live in the Bay Area, people experiencing homelessness regularly live, work, receive services across all the various counties. People move easily across the region on BART and other transit systems, routinely touch many different support systems, and are often accessing services in multiple locations in multiple counties. But the data doesn't follow them. It's completely held in county systems. These are systems that counties have often invested very heavily into, but are all siloed from one another. So it's extremely easy for people to be losing access to the programs, providers, benefits, and resources they need. And it's impossible for their support system to follow them if they cross what is essentially, especially in the Bay Area, a very arbitrary county boundary. They just fall through the cracks. So if you're a homeless service provider and you're serving somebody in a program in San Francisco and that person leaves the city, you will never know if they end up back on the streets. As soon as they cross the county line, they literally fall off your map. Similarly, if you want to set up a regional initiative, as some wonderful partners have been doing over the last years, or even a partnership just between two counties in the Bay Area, with the way that the data silos are currently structured, the scaffolding is missing in order to be able to share the information that you need to work together effectively from county to county or from system to system. So given how much the Bay Area functions as a region, this seriously undermines our ability to respond effectively to homelessness or measure our impact in a meaningful way. So the working group asked us to look into what would it take to set up a sustainable system for sharing data in the Bay Area. Something along the lines of a shared data repository that could automatically pull the data from the independent HMIS systems on a regular daily basis and make it usable at a regional level. We conducted an extensive feasibility analysis in 2020, looking at this question. We were evaluating the Bay Area's existing data systems, the barriers to data sharing, and what models exist nationally and around data sharing across HMIS systems and different systems of care. And what we found was that all of the Bay Area counties have been investing heavily in independent homeless management information data systems. All of those systems share a same set of federally required data elements that are exactly the same in every system. The technology to create a shared system exists. And in fact, there's examples of successful cross-HMIS data sharing in other parts of the country. And the ability to share the data would have a tremendous impact on individuals experiencing homelessness and the programs and systems that serve them. I'm going to hand off to Amanda now to talk a little bit about what the potential impact is from this sort of system and the next steps for setting up a system like this in the Bay Area.
Thanks, Nika. All right. So these are some actual quotes from folks in communities that have been engaging in similar sorts of data sharing across the country. And what we can see from these examples is that the impacts of data sharing are transformative. And we know that there are opportunities at every level. For people experiencing homelessness, it means that people would no longer have to start over as soon as they cross county lines, telling their stories over and over, losing touch with the providers that have helped them in the past, or being lost to the system when program openings and other opportunities come available for them. At the provider level, it means being able to provide continuity of care and coordination of programs and services, no longer losing track of a client as soon as they cross a county line, and being able to find people more often and more quickly when housing and other resources come available that could help them. It would also mean preventing service duplication and being able to align care with the other support that clients are receiving. And crucially, we'd be able to track outcomes and know what's working and what's not to make programs more effective and impactful. At the systems level, it would give us a much more accurate understanding of homelessness in the Bay Area, including racial and other inequities, and who is becoming homeless and staying homeless. We'd have the ability to understand what is working and what isn't, including how we can right-size the services and resources we need as a region and make improvements in areas that could be working better. And it would serve as essential scaffolding for regional initiatives that harness economies of scale and respond to homelessness in a coordinated regional way that more accurately reflects how homelessness is experienced by those in the Bay Area. So the recommendations based on our framework study is a central system that pulls together the data from the independent HMIS on a regular, at least daily basis. The process is automated, so the staffing needs to maintain the system are minimal, and the technology already exists easily to build this out. In terms of next steps, the framework study lays out a roadmap. We have some resources committed already to support system development, and the next steps are to secure the startup funding for the system, confirm a technology or vendor, develop the needed privacy and security protections, and the system architecture for launch. The system starts with HMIS data because all of the Bay Area's homeless data systems share the same set of universal data elements, which makes it easy to align them across all of the systems. From there, the opportunities are incredible, including the potential to incorporate cross-sector data from other systems like healthcare and social services, and a variety of other functionalities that can support regional coordination and implementation of key initiatives. With that, I'm very pleased to introduce our panel today, who can speak more to the immediate impacts of a regional data sharing system, as well as the longer term opportunities. Their full bios are on the registration page for the webinar, but just to briefly go through our incredible panel. To share her perspectives on system planning and impact, we're very pleased to have with us Kerry Abbott, the Director of the Office of Homeless Care and Coordination for Alameda County. We also have Debbie Koski, Senior Program Officer for Housing with Tipping Point Community, who will offer her perspective as a funder of the project. And to help us think through the research opportunities of a regional data set on homelessness, we have Cynthia Nagendra, who is the Executive Director for the UCSF Benioff Homelessness and Housing Initiative. And finally, to speak to the impacts on people experiencing homelessness, we are, one second. We are very pleased to welcome Vivian, the Chief Operating Officer with Abode. All right. We are going to start with a really basic question. How? One second. Apologies for that. So we wanted to start with one question, which is, how would regional data sharing improve the lives of people experiencing homelessness? So just at a basic level, talking about people in the community, how would their lives be changed through regional data sharing? I invite any of our panelists.
Okay, I don't mind starting. Hi, I'm Kerry, everyone. So I think a story that we've told as we brought partners into HMIS to begin with, and into shared data systems within each county was that we don't want someone who is homeless to have to go from place to place to place and tell the same story over and over again. We want them to be able to, if they choose to share their story and they know that they're sharing it with a network of providers, we don't want them to have to repeat themselves. And we have people who desperately need services that may only be offered in one county, even though they are staying in a shelter in another county. They may need to, share. They may have moved to another county and their documents were shared in the county that they came from. And they, their driver's license or their social security card, we may have records of that in one county and not in the other, and waiting for 6 weeks while we try to get that from a state organization could really result in, terrible impacts on a homeless person's life.
I'm happy to say more as well. From a provider perspective, I have to tell you, I went to ask a few of the directors on my team to say, hey, tell me about a time, that cross-county collaboration was really challenging because we couldn't see the data, and they all came in with all of these stories. So there's a plethora of real life examples of really how this impacts. I'll talk about one of them. We were working with a 71-year-old man in Napa County, and Abode, for those of you who don't know, we serve 6 different Bay Area counties, so we're pretty far reaching. So we actually have a little more visibility because we can go into the HMIS systems of each one. It's clunky to go into each one, and then we've also built our own Salesforce database to pull it all together, particularly for those who are housed. So we have that luxury, but still complicated. So we had the 71-year-old man we were working with in Napa. He went over to Solano County, a county that we don't actually serve, and he was receiving services there. We were trying to actually get him connected to Napa County, the respite system, because he had pretty significant physical needs. So there's a respite shelter in Napa to provide for the higher level of medical needs. And we were unable to see where he was, what he was doing to be able to connect him to those services. And, and it turns out he was actually staying in a skilled nursing facility in Solano, but we had to bring him back into an emergency shelter, which wasn't the right level of care. And he had to stay there for a couple of months until we could connect him to the right level of care. So, that's just this is a, 71-year-old man with acute medical needs that we couldn't connect those dots fast enough. Had we had access to those systems, we could have done a direct connection. So that's one example. I have hundreds.
I just want to say that I appreciate that we're starting with this question. Sometimes data doesn't feel like human-centered, or it feels like, like a wonky kind of policy or research need. But I think at the heart of this work is a desire to do better by the people we serve. Coordinated entry, I think, was a tremendous leap. We now at least have no wrong door policies within our county. But, I think, again, as Nika and Amanda were sharing earlier, if clients cross a bridge, all that care coordination is for naught. And, the result of that is, human suffering. Like that's really the result. And so, there's a fundamental design flaw in how we're approaching our work. And so, yeah, again, just I'm grateful that we're kind of elevating sort of the client experience first and foremost.
I can weigh in a little bit from, coming from a research and policy mindset, and I in much of my career have been doing a lot of capacity building. So I think about what evidence is missing? Why are we asking that question? Because we want to strengthen the programs and systems that we are using to prevent and end homelessness, and that is to make people's lives better, as everyone is saying. And so, that question has a lot of components. There's a lot of ways to answer that question, and obviously data is a big part of that. And it's you can get data in a lot of different ways, right? You're talking to people directly, you're interviewing people, you're following people, you're trying to see what their outcomes are, where they're coming from, where they end up. And so when you ask, what questions aren't being answered right now from a research perspective, what evidence is missing, we're asking, how can we improve programs and systems? And one of the things that we do know is that certain people are exiting our systems and we don't know where they're going. So we call that sometimes self-resolution. So we think that some people are self-resolving. In other words, they're exiting our homeless systems or programs and we don't see them again in the system, but we don't exactly know where they're going. And there's two ways to look at that. One is people are exiting without services and without a lot of support. We want to know how they're doing well, learn from them, learn from people who are extraordinarily resilient. And we want to know what it is that's working, that's helping them find housing and stay in housing, where they're going. And a regional data sharing obviously would be extremely helpful for that because we know people are moving from region to region. And we also, I think, it would be really helpful to know when people are falling back into homelessness. I'll talk about this a little bit later when we address equity issues, but when we're talking about people who are falling back into homelessness and it's understandable that people might not touch systems again in that particular community, or they might feel like they exhausted it, or they might feel just that they weren't helped and they don't want to come back. And so finding how people are moving through the regions would help us design better services and programs and how to improve access, how to improve stability services, and make those much more population specific. I'll kind of address the equity issues a bit later, but there's a lot we can understand better if we understand how people are moving through the region and what their outcomes are.
Thanks for that, Cynthia. And I think you all touched a little bit on this next question, but how would homeless service providers be able to do their work better if they could easily access client data across these multiple systems? So kind of zooming out a little bit from the experience of people who are unhoused to the service providers who are doing the work day in and day out on the ground.
Kerry, you and I both unmuted at the same time. I mean, I can certainly speak. This work is grueling. It's hard, right? It's really, and it's sometimes overly complicated. And I've been told not to get too wonky, but there's just so many different funding sources, and there's different eligibility requirements for all of these funding sources. So sometimes we get a little bit lost as a provider and the muck of eligibility and what can pay for what and who can pay for what and all of this. So just from a system perspective, being able to access everything in one system would help us confirm eligibility and really check off a lot of those sort of bureaucratic boxes, frankly, far more quickly, instead of us ultimately getting that person connected to housing more quickly. That's our goal. And at Abode, all of us, our job is to end homelessness for everyone. And we're not really geographically specific, it's just everyone. So, I think that access point, is getting to people faster. We get phone calls all the time from random people saying, I'm connected. I'm like, well, where? What does that mean? Right? So like trying to find where they're connected, being able to access whatever case manager they're already working with, right? So they don't have to tell their story, which is so huge, Kerry. Like the amount of trauma that folks have in retelling their story over and over and over again, it's awful, right? So being able to really minimize that, get people access quicker.
Yeah, and the other thing I would say is the care coordination aspect across providers is tremendous. I was thinking about when I was working in San Francisco, we had someone who our homeless outreach team was working with in the BART station who, clearly had serious mental illnesses and clearly was sleeping on BART and moving across counties. And it took a very long time working with that person to try to discover like who she trusted and who could be most helpful in getting her into housing. She clearly was, very high needs and would be able to access housing through coordinated entry. But even finding out within which coordinated entry system she might already have been assessed was really challenging, and really came down to, calling different health and homeless departments and service providers across multiple counties. So the care coordination is what really jumps out for me in terms of how we can help providers. And there are providers like Abode, like Swords to Plowshares, who are in all the counties or most of the counties, and they're able to do a little bit of that internally, but not with each other. So, so being able to do that across providers and county lines would be really beneficial.
I can talk about sort of my perspective as a funder. So I'm supporting organizations who are looking to effectively prevent homelessness and to house people permanently. As a funder, I have a strong interest in investing in what works. So I want to know that people are placing people in housing and they're retaining housing. As we know, affordable rent is in the east area of the county, and people are experiencing homelessness in San Francisco. A lot of my grantees are placing people out of county just because the rent is more affordable. And so that sort of is a huge limitation, because they can't identify sort of 6 and 12-month follow-up data unless their client is texting them back. And we know that that's difficult often when the client's case manager has turned over, and it's a person they don't know. So we're just not getting the housing retention data that we need for me to know that I'm putting my dollars towards kind of effective housing placements. And so it's a provider struggle, but it's also, I think, a funder's struggle as well. We can't see across county lines. It's a huge limitation.
Yeah, and again, I'm from a research perspective, I'm going to underscore what everyone is saying from a slightly different angle, which is that I think a lot of times when we're asked to do, what researchers are asked to evaluate programs to see what's working and what's not working, what's so expensive is the research part that's expensive is following people. So tracking people down, trying to find them, interviewing them. And that's really important work. And I don't mean to say it's not needed, but it would be a lot, I'm sure, easier for providers and systems and leaders to be able to do some of that work on their own, at least to be able to locate people in the way that then you could try to talk to them and see, how are you? Did you stay in your housing? Did you move? What does stability look like for you? Are you, or does it not look like for you, and kind of what happened along the way? We talk a lot about how interventions are working or not working. And I'll take, for example, I know the short to medium term rental assistance programs like rapid rehousing, we know that it helps people exit out of homelessness, but we know that oftentimes what happens is people are in housing they can't afford, and what they really need is financial assistance to last for much longer. And so to find out what people need and how much they need, is it a shallow subsidy? Is it a long subsidy? Is it deeper subsidy? How are you surviving? How many people do you live with? How can we learn from that about what's working and what's not working? Again, just being able to follow people in a way that is not intrusive and maybe doesn't even require having to reach out to them necessarily. If we could see that in even de-aggregated data, aggregated, de-identified data would be enormously helpful in just designing better systems across, and services across the region to keep people stable.
Exactly. Thank you. And thinking at that regional level, what are your thoughts on how data sharing could empower Bay Area communities to collaborate around a regional response to preventing and ending homelessness?
I'll jump in. I think this is an exciting time for the Bay Area homeless response system. There are so many regional efforts that have emerged. We have the Bay Area Housing Finance Authority. We have All Home and the great work that they're doing there. I know a lot of you who are kind of listening to this conversation today are probably investing in some of those efforts. regional data is just foundational to everything that we're talking about accomplishing regionally. With all the news of public utilities lately, I've probably been thinking about more about utilities than I have in a long time. And actually occurred to me that investing in regional data is kind of like investing in a public utility system, and that it's like a long-term investment. It's sort of foundational to this work. And also it's not very sexy. I'm just gonna say that. Like, it's not exciting, it's essential, and it's foundational.
And I mean, I can add too, like, I think specifically from a philanthropic lens, and I know that's a lot of the folks that are listening, because I have I get to work with lots of different counties and lots of different cities within those counties. And some of those it's a get to, and some of it's a have to, right? Because it is challenging to understand the pressures of each one of those public entities. And I'll have to say that, I think it could help dispel sort of some myths around, bring the services and then they will come, right? So there's always, in every community I go into, there's this idea that, oh, they're not my homeless people, they're your homeless people, right? So, I think it could help us change the narrative around our homeless folks. And I think that philanthropy is going to have to step in to support this non-sexy thing, because, counties and cities have really big problems, and it's sort of, and not to speak for some of, Kerry, you're on the line, but it's hard for them to worry about another county when their county problem is big enough, right? So it's a little daunting, and it's even worse at the city level. Me talking to a city representative, like, well, I don't care about, I don't care about Hayward people because I only care about Fremont people. Like, well, it's really, these lines are, they're not real. They're fake lines. So.
I was also thinking from a really pragmatic perspective that we duplicate a lot of funding in each county, doing essentially the same thing in each county. And, we try to find efficiencies where we can, especially around like data system build out, things like that. We try to, piggyback or, learn from each other. But without the data sharing motivation, it's really hard to have a joint project. And if we could do better joint projects in terms of data system build out, I think that it would be totally, aside from all of the human advantages, it would be a tremendous financial advantage.
Absolutely, appreciate those perspectives. I also wanted to talk about something that Cynthia alluded to earlier, which is the question of using regional data to better understand and respond to racial equity issues related to homelessness. Talk a little bit about that, about how we'd be able to leverage some of this data to look at racial equity issues in a new way.
I can start since I touched on it a little bit earlier. I mean, obviously, this is a very complex topic and complex conversations. There's a lot of ways to talk about race equity and how to look at disparities and then how to respond to those disparities. And I don't think that we have those answers yet. I think that our field has come to this conversation now and is really thinking about, and some people have been thinking about it for a long time. And I don't mean to say that we're all just arriving at it now, but we're coming to the place where I think we're really understanding how to think about disparities a little bit more in a more focused way and in a more responsive way, and really think about what does it mean to to respond to these disparities. We have known for a long time that people of color, particularly Black people, are far overrepresented in the homeless population. In most communities, certainly across the country, it's about 3 times the general population. But even compared to people living in poverty in many of our communities, especially in the Bay Area, we know that people are far overrepresented in homelessness, and we want to make sure that our programs and systems are not leading to further disparities. There's some things we can control, there's some things that we can't, but sort of focusing on what we're doing to further those disparities and making sure we're not doing that, and making sure that we are finding ways to structurally and in a system-wide way respond to those is, I think, what we're all trying to work towards. And that there's making sure that people's experiences are at the center of what we're doing is really important, and data plays a big role in that. But the really, I think one of the ways we have to understand disparities is and learn how to respond is to understand, where the disparities are. Is it in access? Is it in housing placement? And we know, I've seen many communities' data that it's in recidivism, that people who are Black are recidivating at a higher rate than a lot of other populations and demographics. And we want to know why that is. Alameda County has done some incredible work using an equity lens to look at their programs and systems through a lot of focus groups, a lot of actually talking to people experiencing homelessness or with lived experience to understand better how to improve programs and systems, and also what new interventions are needed. But I think that, again, figuring out how people are self-resolving or if they're recidivating, we have to know where they're going and where they're ending up and where what outcomes are impacting people, and how we can actually improve services. And we don't know the answers, I think, to responding to all the right ways, but we have to be able to use that data to inform our responses.
Yeah, I was thinking about the comment earlier about the self-resolved, or really we don't know what happened to this person. And if we had regional data sharing, how much more we would have that information and be able to look at it. And, one of the things that I'm really curious about is the racial dynamics and cultural dynamics in people's choices in going from one county to another. I really, I think that there are only a few agencies that have like mom speaking case managers who know how to help resolve someone's homelessness. And that there are not that many agencies that really understand how to culturally be there for a Native American person who has become homeless, and that we may be able to see in some of those dynamics, some of those don't knows as we answer them, what's really going on. Are we seeing people leaving one county, going to another and resolving their homelessness? And why is that? Why were they able to have a better outcome in one place than in another place, or one agency than in another agency? And that's so hard to extract right now. Where we have been doing a lot of work, as Cynthia said, on trying to disaggregate all of our outcomes by race and ethnicity, and really getting down to where are the positive outcomes coming from, and why, and what can we do, what have we done that makes the biggest difference, and how can we improve on that as we go.
The work that Kerry and Cynthia are talking about happening kind of at the systems level, my grantees are also doing at an organization level. And like Cynthia said, this work is not new, but it also is new for a lot of the organizations I support. They're just now starting to disaggregate program outcomes by race. And again, if you don't have program outcomes, you can't disaggregate them by race. So that's kind of the fundamental challenge. For organizations that are more kind of small, based in one county, folks are staying in one county, we're starting to get some of that information. And honestly, it's really exciting because it's enabling organizations to kind of take that feedback loop and deliver more effective services. But for organizations that don't have that information, it's a real challenge.
Yeah, and I'll just add that even those organizations that do have the information, it's really limited. So, you know, we, like others, have been working on taking a deeper dive into diversity, equity, inclusion work. And we're actually doing a full analysis in all of our counties on both access and outcomes, you know, from in that lens. And we're, you know, contracting out. So it's a real sort of external look into how we're providing services, but still those are super siloed within each HMIS system. We're not really able to see the movements. You know, we can compare county to county. Is it the intervention? Is it how we're providing services? Is it how the program's designed? Is it how the coordinated entry system is built from an access perspective? Because we're an agency that receives all of our referrals through coordinated entry in all of the counties that we serve, right? So what are the levers that we can pull or push or change to really improve the outcomes, particularly of folks who are Black and Indigenous, which are the two biggest disparities that we see in outcomes.
Yeah, if I could just build on that. I mean, this is obviously, we could talk about this in a lot longer, but there's so many pieces of it. But I think with data especially, I think we have to try to balance, you know, being willing to really make sure that we're not getting stuck on things like, oh, it must just be the assessment tool. And if we change the assessment tool, we're going to focus all of our efforts and that's going to change everything. Really, it's, you know, looking at all of these different pieces and then also being really willing to blow up some systems and really think about what even though we've invested in a lot of infrastructure, that we may need to really change that infrastructure. So, but that doesn't mean it's always the case. So data can really help us identify these different areas. And also we have to take, you know, kind of be more honest with ourselves about what we really are willing to change and not change. But it does take sort of, I think we have to be careful not to kind of get stuck on one small piece of the whole system and think that that's going to fix things.
Yes, exactly. Thanks for those. We've got time to do maybe one more question before we open it up to some Q&A. So just a reminder to folks, please feel free to add questions in the chat. I see a few that have come in. But let's close with one more question to our panel before we go there, which is, what's one unanswered question that we have about homelessness in the Bay Area that could be answered by a regional data sharing system?
When I talk to people about homelessness and who aren't doing the work and about how unsolvable it is, I always tell people it's not unsolvable. You find out who needs housing and then you give them housing. And so, and other counties are doing it. There's models across the country. Like, who are the people and let's house the people. And so the question that I think is really compelling for me is, who are the people, right? Like, who are the deduplicated people? Like, who are the people that are entering homelessness? Like, we just need to know kind of the scope so that we can begin to address the issue. And there are some people that would say, you don't need to know how many people are homeless. You can, you know, they're in front of you, right? Like, how's the person in front of you? But I think if you're trying to take a systemic kind of permanent approach, it's a fundamental question.
And I think I've said it a little bit already, but you know, I think understanding who our shared clients are and why would be really instrumental in creating housing plans for people and in responding to their needs. We've, within our county, been able to do a lot of data sharing between the healthcare system and the homelessness response system. And that alone has given us a lot more insight. And if we could go further than that and also share with our neighbors and receive data and information from our neighbors, then it would go a lot further.
For me, the unanswered question, Debbie sort of hit on it earlier, is what works. So specifically to like rapid rehousing and these shorter term interventions, it's really hard to see the long-term impacts. And, you know, I want to solve homelessness for the long term, not while they're receiving rental assistance, right? So, you know, for me, I want to make sure that what we are providing is working for the who, right? So, and right now we just can't see that as effectively as I would like to see that, because we can't follow people in the way that we really need to.
And I'm going to just probably say something very similar, but I think certainly building on what works, you know, where I think one story that we'd more like to know more of is thousands of people get housed and stay housed, and what is it that they're doing to stay housed, and also, and some people didn't even get assistance. So what happens to the folks that don't get assistance? But also, if people are unstable or they've fallen back into homelessness, what would it take to get them back into housing? Is it financial assistance? Is it what are the things that a person needs to stabilize? And we don't have a lot of good answers to like, we could do better in sort of stratifying housing options and figuring out what those look like. And I think sort of understanding where people are and where they end up after services, like as everyone is saying, is just would really help us understand, what do you need to stay housed? What do you need to get back into housing? Is it $1,000? Is it much more intensive services? Is it a car? You know, what is it? And how can we think about tailoring what we do?
Yes, all really important questions, and ones that we're hoping we'll be able to answer as we move forward. But speaking of questions, I do want to just remind folks to please go ahead and add any questions you have for our panel or related to our presentation in the chat. We're happy to address those. One that I saw come up a little bit earlier was about just trying to understand the different data sharing laws or rules that are out there in terms of HMIS or other case management systems versus research and policy work. You know, Cynthia, maybe you can jump in on this one as well, but I will just plug that in the data sharing feasibility study that we posted a link to in the chat earlier, Homebase does outline in a little bit more detail some of the privacy laws that are implicated by HMIS and data sharing. A big part of kind of the goal of any data sharing system is, of course, being good stewards of the data that is being given to us by the clients or participants. So that is certainly integrated into what's envisioned for this data sharing system. But Cynthia, do you want to talk a little bit from a research perspective about some of those legal considerations as well?
Yeah, I mean, from a research perspective, depending on the type of research we're doing, you know, any human study research is going to have a much higher bar for what permissions we need to be able to do that. So sometimes we have to go to an institutional review board to, you know, really be able to get that's what makes research much more difficult and slow. But if we're using, you know, human subject research, and especially if we're looking at anything personal like medical data, health data, anything like that, if it's identifiable, then there's a much higher bar. But I think that if you took researchers out of the picture and if we were looking at aggregated or de-identified data, which is not always as helpful in terms of, it depends on the scope of the question that we're asking. But I think that if you take the researchers out of it, systems, COC systems and system leaders and jurisdictions can share data if they get permission. There's all types of permission and data sharing if you're, I think everyone else could probably speak much more clearly to this, but if you're getting permission and releases of information from clients that are participating, I think you can do a lot more with it.
Thanks, Cynthia. I'm seeing a couple of questions in the chat about just kind of acknowledging that data sharing and data transparency is pretty scary, you know, especially as we think about it from a political perspective. So just really interested in the panel's perspective on what helps people to get more comfortable with this in terms of sharing data or being more transparent, because I know we've seen those trends over the years for communities, but what's helped us to get there and what will continue to help us as we move forward?
I think being transparent about what you're being transparent about is helpful. You know, having real conversations with clients. And, that happens at that initial kind of like intake, first meeting setting, and like really being clear that, what data we would share and why we would share it. And there's a lot of self-direction involved. Clients have the ability to say that it's for, a shorter amount of time, or only these types of, key sort of informational pieces. And they have the right to revoke that sharing. And so, and like as a former direct service provider, like what I heard over and over again is like, yes, please, whatever is gonna, whatever is gonna help me get into housing. And so I think the legal challenges are certainly like complex. But I think that, overall, it's how we tell the story and how well we can make clear what we want the information for.
And I think from a systems perspective as well, this idea of deduplication is really important, right? That I think from a funder, like, it's scary, again, if a county is like, oh my gosh, what am I going to find? Is it going to be more resources, right? Am I, more resources beyond, part of, the selling point is, are we using our resources wisely? How much does it really cost? Are we duplicating? And again, we need to really frame it in a way that it's not like, oh no, that's your problem now, not my problem. We have to, come together. So I think there's a way to do that. But I think that it could be framed in a research rich way. I know Santa Clara County has done a lot of work in this, in the data sharing across systems, and Abode is the provider of a Pay for Success, a social impact bond project that has a heavy research component too. It's a randomized controlled trial, so sort of the Rolls Royce of research on top of it. But that they've created systems and data sharing beforehand to make that happen, right? And that my clinicians can go in every day and see if that person showed up in the emergency room. And that's extraordinarily helpful in keeping them housed, right? So it's, and the outcomes are amazing, right? Because we're able to see, not only at the front end, but as, we're housing these this is the tippy top of the high need spectrum, right? Making sure that they are still staying in our care.
Thanks for that. Oh, go ahead, Debbie.
This question of sort of the politics around data is asked frequently, and I haven't been working in this field for 25 years, like some of the people I've talked to. And so I think sometimes I have this like blessed naivete, but what I have seen is that for the last 18 months, the counties have been closely collaborating with Homebase's support. And I think that there's a real, moment in time where there's a hunger for regionalism, but I think that there's a recognition that we have got to collaborate to address the problem. Like the situation on the streets, we're all seeing it. The impacts of COVID long-term are still to be seen. So it's, are there political obstacles? Like, yes, we see it in the field, but also, is this already happening? Yes. So I think that that's kind of a tribute to the county leaders and their commitment to this work. It's a tribute to, the database leads, the HMIS experts who are also at the table. So this is work that's already being done.
Thanks, Debbie. I also wanted to acknowledge a question we were seeing that was kind of asking about the different ways in which regional data sharing could be impactful. And maybe folks could speak a little bit more in particular to how this sort of table or this sort of system could be used to both identify and support people at risk of homelessness when we think about that population in particular.
It's something that the question reminds me of is the research that was being done in Los Angeles a couple of years ago, where they found that that before people become homeless, you see these sort of spikes in requests for assistance and in healthcare visits and in, you know, like social services calls, things like that. And like there are indicators that we can follow. And if we know, oh, this person, we're seeing, you know, this pattern here, and this person was homeless before, then you really do, like, you know, that should be our call to action. And so if we're tracking, and people will at risk of homelessness will call in multiple counties, like they're trying to figure out what their options are when they lose their home, and you know, they're trying to keep from ending up outside. And so I think that that following that, and obviously, you know, if we are able to look at it together, responding together and responding most appropriately.
Yeah, I think that could be incredibly powerful in the advocacy arena as well, and you know, connecting sort of the diversity, equity, inclusion work, and that, you know, a lot of the folks that are falling into homelessness are doubled up, and what we consider doubled up, but they're you know, living in culturally appropriate situations, and yet, you know, maybe a family member might be on a housing authority voucher that's putting everyone's housing in jeopardy because of sort of archaic rules that are really not, you know, steamed in, you know, in DEI work, right? You know, so it's like we're creating sort of unneeded bureaucracy when we don't, you know, keeping someone housed might not be changing much other than a rule. Right? You know, so I think that it could really help us on the advocacy with some of our larger federal partners as well.
Exactly. Thanks, Vivian. And knowing that we only have a minute left, I'm going to let that be our final comment from our panel for today. I wanted to first off just thank everyone who participated in today's conversation. It's been incredibly insightful into just really understanding what the opportunities are around data sharing. I also want to acknowledge some of the other questions in the chat that we're asking about kind of next steps or where we go from here. There's a ton more information about that on our website. There was a link put in the chat earlier, but it's also up on the screen for everyone, along with the email addresses for myself and Nika. But you can access our full behemoth of a report, as well as a shorter overview document that tells a little bit more about kind of where we go from here in terms of implementation. So with that, thank you all so much for joining us for today's webinar. And we appreciate everyone's robust participation. Thank you all.
Thank you.